Namaste. I welcome you all to this session 6 of Gurubodha series with Dr. M.B. Gururaja sir. I cordially welcome Dr. M.B. Gururaja sir to this function. And I am the convener. I am Dr. Janardhan Hebbar. I am the founder of easyayurveda.com. I dedicate this and all of my works at the holy feet of my spiritual guru, Dr. A. Chandrasekhar Udupa. Dr. Gururaja sir is with us here today. He is a professor in an Ayurveda college and has been a practitioner for more than 21 years. So his clinic, Ayurveda Center, is there in Shivamogga, Karnataka. The clinic name is Dhavala Pentacare Ayurveda Center. So first question today is that regarding the Mutrala or the diuretic action of Gokshura or Tribulus terrestris. It acts as a diuretic. It is Shotahara, meaning anti-inflammatory. That's why it is there in the Dashamula group of herbs. And it also acts as lithotriptic, meaning it is very frequently used for the treatment of urinary calculi. Gururaja sir, can you please explain us the Mutrala action or the diuretic action of the Gokshura?
This Gokshura is one of the Samhana Pratyarabdha Dravya. If you observe the drug potential, it is Guru Snigdha in Guna, Madhura in Rasa, Madhura in Vipaka, Shita in Virya, Ashmari Bedana is its Prabhava. So if you go through these observations, what the drug potential has been explained, Guru Snigdha Guna is very clearly from the Prithvi and Aap Mahabhuta. Madhura Vipaka, Madhura Rasa is also once again from Prithvi and Aap Mahabhuta. Shita Virya is also from Aap Mahabhuta. So any drug with this sort of internal configuration is always supporting the urinary system to produce a Mutrala action, provided a precondition prevails inside the body. So anyhow, this will going to improve the urine output once it is taken, and it is specifically action or pharmacological action based on its Rasaguna Vira Vipaka to some extent. But its lithotriptic action or Ashmari Bedana action is due to its Prabhava. How this drug is going to break the urinary calculi, it is not known as such. But it is extensively used, and we are also getting the results in a patient when it is given. So this Gokshura, basically, even though we anticipate that a drug which is Tikshna, Ushna, that only can break the stones or Ashmaris. It is not so. This drug is also acts as Ashmarigna by its Prabhava. And of course, it's a Mutrala, so helps to expel the content in a more quantity from the urinary tract, hence acting as Mutrala. And that Mutrala effect is also profound or even go hand in hand with that Ashmarigna effect. Then it will be allowed to expel the stones or the urinary things. So that's the reason we use a lot of Gokshura in particularly with Mutra Krichra, Mutra Daha and Mutra Alpata and even urinary tract infection or urinary calculus, these conditions.
So most of the herbs which act as Mutrala or diuretic, which produces and expels urine, so they are often, we see that it is Shita Virya, right sir?
No, it is not so. There are drugs which are also Ushna Virya can also do, because Ushna Virya Dravya can also stimulate the Vrukka or kidneys to produce more and more urine. They also can help it. Even for example, Kshara. Kshara is hygroscopic, but it is Tikshna Ushna. Because of its hygroscopic nature and Tikshna Ushna, it also helps in acting as a diuretic. It also produces more urine. So that's the reason we don't find that only simply based on Shita Virya or Ushna Virya the drug will act. No, it's not like that. It's a complex issue. Here this Gokshura, because of its configuration, it supports the Mutrala activity. Of course, in case of a Kshara, because of its penetrative and Kshara Guna and even hygroscopic nature, it helps in production of the urine or even expulsion of the urine.
Thank you, Zaid sir. And most of the lithotriptic action of most of the Ayurvedic herbs, the pharmacology of behind it is only understood by its action or its prabhava, right sir? Because I mean there is no chemical way in which we can explain these herbs with their lithotriptic action.
So that's what I said. With the Rasa Panchakas of a drug, not in a right way to explain this, because Acharyas have very clearly mentioned these karmas, specific karmas of Ashmari Bedana and Hridya, Krimigna, all these things are Prabhava. It is due to Prabhava. Prabhava is Achintya Virya, it is said. We cannot explain on the basis of Rasa Panchaka, how this drug working in this condition. So it has to be accepted as Aptavachana, explained by Acharyas. It should be considered. And of course, when we are using those drugs in reality, it is producing the similar type of effect what the Acharyas have said. So we need to accept that in totality.
The triple S terrestris as triple S supplement has been very frequently used by the bodybuilders, especially the Western bodybuilders. And in how to explain that, sir?
Very clearly explained while explaining the qualities and potentials of the Gokshura. It is a Shitala, Swadu, Balakrit, it is said. So, and it's also said Basti Shodhana, Deepana, Vrishya, Pushtida, the term is said. The Pushtida means it is Brahmana only. So this drug has been explained as Balakrit and Bostida in the very beginning. In the Bhava Prakasha itself, he has mentioned it. So definitely we don't find any wrong in use it by the bodybuilders. And it has got a Brahmana effect and many people use that. But provided how far it is good to build the body or muscles in such a way that is a big debatable question. That is another part of it. But using Gokshura for this condition is not a bad idea because the drug has been explained as Balakrit and Pustida, which supports that action.
Can it be used like before food, or bodybuilders or yoga people, if they want to have extra strength while they are performing, can they take say Gokshura decoction or Gokshura churna or capsule or tablet ahead of their yoga sessions?
No, it is not used in that fashion. It doesn't mean that it should not be used on empty stomach, or it can be used on empty stomach because it's a Madhur Rasa Dravya and Madhura Vipaka Dravya. It doesn't make any difference on empty stomach if you take it also. But it is not a drug of such a nature that gives instantaneous energy to you to perform in the next session. When you're doing yoga or pranayama or even wrestling and this, it is not so. It is not such a drug which can instantaneously give you some support. It is on a long term or a long basis. You have to use this drug, and accordingly, then the results will be seen. So taking that drug in the morning or even that doesn't make any sense. There is no hard and fast rule that it should be taken on empty stomach or it should be taken in the morning or before any exercise sessions and all those things. No such issues.
You are right that because it is diuretic, some may get an urge to go to washroom if they take it just right ahead. And sticking to this bodybuilding, are there any herbs or any medicines which give instant energy that I can lift heavy weights?
No Ayurvedic such drugs because it's very clear one could be able to lift anything or do the things based on the bulk and capacity of the muscles what he has. And of course, it can be developed only by Vyayama. A continuous Vyayama will help in bringing the toning up of the muscles. So that the toning of muscles can be done by Vyayama, and without that, simply just taking some medicine or some drug which will instantaneously give you boost your energy to do that is not so. It is not possible. And whatever our Ayurveda drugs have been explained for this type of purposes doesn't act in this sense of instantaneous results. It will not be there. It is a cumulative effect what we could see. The other important part of it is that what best drug combinations can be used for these purposes. Yes, definitely we can go for Gokshura containing lehas, or you can go for Ashwagandha containing lehas, or even you can go for Ashwagandha containing Gritha, or even Ashwagandha churna with milk, and even you can go for, if you are not having any issues with the non-vegetarian part of it, then you can go for the Chagalyadi Gritha or Ajamamsa Rasayana. So all these things are there which can be used for these purposes.
One part, I mean, even Ashwagandha has diuretic action, but it is Ushnavirya. So I was wrong in saying that most of the Mutra drugs need to be Shitavirya. What you are trying to say that this Gokshura, Ashwagandha, Shilajit, etc. over a period of time when it is taken, say for 4 to 8 weeks, 4 to 8 to 10 weeks, they will improve the stamina and thus they can be used as a gym supplement as rather than as a instant energy booster ahead of a session.
Yes, definitely. You see, Vyayama Ardha Shakti, he said, where one has to do the Vyayama according to its capacity to half of his strength. So after that, whatever we regularly do it accordingly based on that exercise sessions, we try to develop the tonicity of the muscles or building up of muscles. It doesn't mean that simply just take medicine or some drug or supplement instantaneously will develop some muscle. It is not so, and it is not possible also. So before going to any session, if you take it anything, doesn't make any sense. It's just simple energy you would have taken, even simple sugars will support you in that sense.
How do you use Gokshura in your practice, and what are the formulations, and how what are the remedies that you use frequently?
Usually Gokshura I prefer in urinary tract infections and urinary tract issues and renal calculus, Mutra Krichratra, dysuria, and even burning sensation in urine and these type of things. In these conditions, I use it, and preferably I use it in the form of Ashmari Harakada, Gokshura Adi Gugulu, as well as in Shatavari Adhigritha. An important reference is there. If anybody wants to try that combination, if it is available to them, can go for it. Gokshura Churna, Bija Churna, plus Makshika and Avikshira, the milk of sheep. It is taken for 7 days. It helps in Ashmari Bedana, it is said. So such combinations can be tried if you get all these ingredients at your disposal.
So Makshika is Sarna Makshika or the honey?
And then it is honey.
Somebody has asked, Gokshura Ksheerapaka is useful.
Definitely, we recommend Gokshura Ksheerapaka and even Gokshura the Kashaya third trimester of pregnancy. In third trimester of pregnancy, or any patient if they have got a complications of pregnancy like eclamptic conditions and preeclampsia or such type of things, or pedal edema and those type of things, then we recommend Gokshura the Ksheerapaka or Gokshura Ksheerapaka.
That mainly acts as kind of diuretic. Thus it helps to reduce the edema, and also in an indirect way helps in managing the blood pressure as well.
The entire drug itself, we observe that it is Sheetala, somewhat convincing and even supporting to the body, even to the growing fetus inside. It doesn't make any harm. So such a drug with wonderful activity of even diuretic action. So that's why the in that area.
Does Gokshura create heartburn or acidity?
No, it won't. Because it's a Madhurasa Dravya, it is Madhura Vipaka, Shita, Guru Snigdha Dravya, so it won't cause any heartburn or anything like that. If a person is having severe acidity already, or a person who is having literally, his Agni has gone down too much, in that condition, if you pour 1 glass of this Kashaya or something like that, then the things may worsen. Those conditions should be kept in mind where we are using it.
Some Ayurveda practitioners have seen using Gokshura for cholelithiasis, gallbladder stones, because they correlate it with the Ashmari Hara action. So do you use it, or do you approve of that?
Based on the concept, it is accepted, but for the purpose of gallbladder stones, my best choice would be Kokilaksha Kshara. Kokilaksha Kshara has been explained in the texts that it is good for Pitta-Jashmari. So we correlate Pitta-Jashmari to cholelithiasis, and it is a better choice than Gokshura to treat cholelithiasis or even the gallbladder sludge.
Any pharmacy that manufactures it, sir?
No, I get it from one fellow in Maharashtra. They produce it their own. I think Swami Samartha Ayurveda, something like that. It is there.
Online, I think it's available with VHCA herbals. During pregnancy, with who suffer with urinary calculi or frequent urinary tract infection, Gokshura is kind of very ideal versus Kshara or any other thing.
Definitely, when pregnancy is there, we don't go for the use of Ksharas. But of course, it's a very rare phenomena that in a pregnant women we come across with urinary calculus and all these things. Usually, we don't come across such cases. It's very rare phenomena.
Moving on, this is a little bit wide question. There are many Ayurveda medicines for one particular disease. I would like to know which to prefer when. For example, for Vata Rogas, we have Mahavata Vidwamsa Rasa, Vata Gajankusha Rasa, Samira Pannaga Rasa, Rasaraja Rasa, etc. So I remember you explaining using Rasaraja Rasa in one massive case of splenomegaly. A patient was almost in the deathbed, and splenomegaly was reduced drastically. This was back in 2001, 2002 when we were taking classes. So list of medicines are sent in the chat. So Mahavata Vidwamsa Rasa, Vata Gajankusha, Samira Pannaga, Rasaraja Rasa, Palsinuron, all are generally told as for Vata Rogas. Same goes with like Vatahara Kashayas, Vatahara Asava Arista, say Ashwagandha Arista and whatnot, Balarista. So how to decide which one to pick when?
So it's of course it's a very wide question. We need to understand the basic qualities of Vata first. So whenever there is a manifestation of Vataja Roga, we need to understand whether Vata has been directly involved, whether it's by Vruddhavastha or Kshayavastha, maybe leading to something, or with Avarana, such concepts, the Vata Roga has been taken place. And we need to understand whether it is what type of Vata which is involved, or because of which Lakshana qualities of Vata, the Vata Vruddhavastha, like for example, whether because of the too much of Rukshata has led to the Vata Roga, whether too much of Shitata has led to the Vata Roga, whether due to more quality of Lagu Guna leading to Vata Roga, because we know that Tatra Luksha, Lagu Shita, Kara Sukshmos, Chalo Anilaha. All these are the qualities of Vata. Any qualities may increase to we call it as a Vata Vriddhi. So we need to understand whether it is Dravyata Vriddhi, Gunata Vriddhi and Karmata Vriddhi of the Vata. Accordingly, then finalize it, what type of Lakshanas have come and to where to match it. Once that is established, then accordingly select the drug. The thing is, many a times we find the patients of Vata Roga, maybe I'll take an example of Pakshagata. As soon as it has happened, the people will approach to doctor. So in such a condition, then we need to go for breaking the Samprapti to give instantaneous effect. So then we need to select a stronger and a penetrative capacity drug in that condition. So in that sense, our best choice would be Ekanga Vir Rasa. Ekanga Vir Rasa has got lot of Ushna Tikshna Dravyas in it. Parada, Gandhaka, Kantaloha Basma, Tamra Basma, Naga Basma, Vanga Basma. Along with that, it has got the Trikatu, Trifala, as well as even Nirgundi, Chitraka, Arka, as well as even it contains Vishamusti. So many drugs are there which are very penetrative, very sharp and very Tikshna in nature. So such drugs are used in that making of Ekanga Vir Rasa. So definitely our choice would be Ekanga Vir Rasa in that condition. Similar to Ekanga Vir Rasa, we have another drug, Mahavata Vidwamsa Rasa, almost similar ingredients except one or two changes. But it contains, instead of Vishamusti, it contains Shuddha Vatsanaba. So my choice would be wherever there is pain as a more dominant feature in case of Vata Roga, then I select Mahavata as the drug of choice. Wherever Karmahani is there, in that Vishamusti combination present in the Ekang Vir Rasa, which is spinal stimulant, supportive to the Naranadi. So then I select Ekanga Vir Rasa wherever there is a Karmahani. So this is the basic two things we need to understand. Then we have another set of paralysis patients. Usually they have already gone through the acute phase and they are settled down, and now with deformities or something like that, or a chronic nature of more than 6 months or 1 year old, then in such a condition we need to select such a drugs which are penetrative as well as which are Brahmana in nature, because due to the disease many a times the person has lost his muscle tone, body weight, so wasting will be seen. So in order to overcome these things, then we need to select such a drugs which has Swarna Basma in them. So for our disposal for that Swarna Basma is, one is Brihat Vata Chintamani, the other one is Rasa Rajeshwara Rasa. These two drugs combination has to be taken care. And regarding wherever there is a pain, the other option is Vata Gajankusha Rasa. So totally all these drugs can be selected. That depends on the type of Vata involvement, Lakshanas evolved out of it, and what the presenting complaints are, whether there is a bleeding, whether there is an infarct. All these things should be kept in mind, because sometimes it is avarana or sometimes direct increase of the vata. Many a times a paralysis patient comes to us is usually suffering from hypertension, and he has not taken the medicine or not knowing that he is suffering from hypertension. So suddenly one fine day he'll develop that weakness in the limbs and facial turning and all these things, and even the loss of strength on the part of the, all these things are happening. And such a type of patients, we can't straight away go for a Tikshna Dravyas, but we need to assess whether it is due to infarct or whether it is due to bleeding. If it is due to bleeding, we don't want to go for the Tikshna Aushadhis at once and cause further bleeding. So we need to go for Swarna Yukta Aushadhis like Brihat Vata Chintamani. Because Brihat Vata Chintamani also contains Pravada Basma in it, it is soothing. So such combination has to be taken care. Whereas in case of infarct, definitely we need to go for Ekanga Virasa to break up the things. So all these things has to be with point of as well as the modern evaluation techniques or imaging techniques. We need to take the help of those things and ultimately combine together. Best suited combination can be use it for the patient.
That was a mind-blowing explanation of various this one in a shortest period possible. Ingredient-wise breaking down and studying individual ingredients, then again go to the basic principles, Rasa Guna Virupaka, and that's how we can come up with this in practice. Do you use Palsinuron, sir? It contains a
yes, definitely. It's one of the wonderful combination available in the market, and it is. I use that in all sort of neuralgia, neuropathy, and even in Pakshagata, that is paralysis, and it's a very good one available in the market. It is a combination. Once again, it is a proprietary medicine with backup of classical combination. Contains all the Ekanga Rasa, Samirapana Rasa, all these things in small quantities. With that, they are improved some combinations. They've added to that, and of course, it's giving wonderful results. People are using it, and even I am using it.
A question has come like for polio or cerebral palsy, Brihat Vata Chintamani, is it a good choice? Someone is asking, sir.
Yeah, definitely. You see, all where there is a neuropathy and neurological condition or anything which is with the nerves, we can go with the Brihat Vata Chintamani. But definitely where there is a palsy of this nature of very young age, better you can go for the Swarna Bhagasma containing materials like Brihat Vata Chintamani or Rasa Rajeshwar Rasa.
Can we use Gokshura in diabetes with foamy urine or Punarnava would be useful? For diabetes with foamy frothy urine, Gokshura versus Punarnava, and kindly throw some light in diabetic management of Ayurveda.
No, for the management of frothy urine and diabetic management, I don't know why we have to select Punarnava or Gokshura. We have better drugs to select. We can go for with Madhunashini, we can go for Nishamalaki, we can go for even Kiratikta, we can go for the Methi. There are plenty of other things, Karavellaka, Asana. We have got so many drugs are there. So we can use that. I don't know why you want to go for that. If it is a frothy urine, you just try to understand it contains proteins. So it is an indication that it contains proteins. Then the patient is in diabetic renal issues connected with that. So we need to check out the microalbumin present in the urine. Then accordingly, when the one reading will be there, then we can select a proper drug for the protection of the kidney. So we can use it to Shilajatu, even Gokshura also can be used for that purpose, but it is not for the intention of going to what you call frothy urine to control it, but we need to control it on the protein dispelling through the urine. That has to be controlled.
And in urinary tract infection associated with burning urination and pain, Gokshura and Dhanyaka Hima works, but slowly. Anything you can suggest for quicker action?
We can have combinations. Gokshura, the Kada is there. You can go for even Sariva is there. It can also be used. Even Chandana is there. You can go for it faster relief.
I mean, if the urinary tract infection is like of more serious nature, or if it's chronic, then even the more serious medicines like Chandraprabhavati would come into picture.
Definitely. Chandraprabhavati will also be there. So see, first of all, simply not selecting any medicine. We need to understand the disease process, and we need to come at what level his disease is and what is his body nature. All these things, basic information, if it is there, then you can go for selection of the drug. That will be better choice, a better method of handling the condition. Then you will have better results also. Simply just some drugs, and if you just give us some medicine that may work, may not work, that is another issue. May not suit him. So that is also another issue. So better we need to go for observe that what exactly the reason behind the presenting complaint. Based on that, then try to select a combination which is most suitable, and you have a confidence on that combination of similar conditions you have treated in the earlier cases. So all these things come into play.
Yes, mere just compilation of symptoms and trying to shoot that with the single apps or home remedies. It's not how an Ayurveda doctor would analyze the symptoms. Can you please explain more about the uses and benefits of Mahavata Vidwamsa Rasa?
Mahavata Vidwamsana is useful in all sort of Vataja condition where pain is the main reason, because it's a Ushna Dravya, it contains lot of Ushnata. You need to be very careful when you give a particular dosage. Then sometimes the patient may complain of irritability in the bladder as well as irritability in the stomach. So adjust the doses accordingly. But main intention is that wherever there is a neuralgia condition and a neuropathy condition is there you can use Mahavata Vidwamsana Rasa.
Probably it is useful in this ankylosing spondylosis also, sir.
Ankylosing spondylosis and even cervical spondylosis conditions you can use it, but provided patient should be able to withstand this, because it is tikshna and it is penetrative in nature. Some patients may come up with some side effects or untoward effects could be seen. So we should be careful while prescribing this dosage.
Chitraka is there, Ardraka, Trikatu, Vatsanaba, Tankana, Tamrabhasma. This is a question that has come. Like when a client comes to you, this is like basics of 101 of the initial case taking or observation procedure. How do you start conversing with your patient, or what are the questions that you ask, what are the things that you observe, how do you note, or you just hear to the symptoms and then write the case, or how do you approach that initial few moments?
So usually when I get a patient, I'll go through some basic idea. I can get it from the very first instance of when I observe him. Of course, and the patient will have a presenting complaint, the more which is annoying to him, that he will be explaining it, like pain or whatever it is, skin conditions or whatever it is. So that's the one criteria that for what reason he has approached me, that he wants solace in my treatment, that a particular thing is causing problem. For example, maybe skin condition with severe itching. So he will be going on the terrible itching and it is causing trouble to his day-to-day activity and these other things. So when a patient approaches me, that I'll go through his name. By the time I'll also get his somewhat an idea about his religion, and based on that somehow his food habits I will infer. So based on that, then I ask a few direct questions regarding his work or occupation. Then I'll go for food habits. Then the presenting complaints, whatever it is there, I'll go by listing it, and then accordingly, then analyze it, observe the patient. So based on the primary criteria of Darshana, Sprashana and Spashnehi Parikshyacha Roginam, this concept is involved. That is Darshana, observation, Sparshana, palpation and percussion and all those things if it is required. Then asking questions, numerous questions regarding things, maybe sometimes leading questions or maybe sometimes to get the answer from him, to know the exact nature of his way of living. So many things comes into play. And of course, it's by your own habit and your experience, you will come to know that by seeing the patient many times, you can jump up the ladder, not even going for a routine questioning. Observation, you can come there. So based on that, once it is finalized, then you can analyze whether it is Bahudoshaja Vyadhi or Alpadoshaja Vyadhi, based on the duration of the lakshanas and all those things. How long he is taking this treatment with some other doctor, or how long he is suffering from this condition. So based on all those factors, then I decide whether the patient can be taken for Shamana or Shodhana. So once patient is suitable for Shodhana, whether it is a Vamana Yogya Purusha or Virechana Yogya Purusha or whatever it is, so once that is finalized, then we'll go for a planning. And then comes the role of patient. Then whether he is able to afford the treatment and all those things will come into play. If he is able to afford the treatment, then we go for that, and he has a time and everything for the purpose of Shodhana Karma. If it is not there, then obviously we go for sharp acting and penetrative drugs with containing sukshma qualities in them, and such type of combinations are taken, and we will venture into shamana things. Of course, shodhana has to be done, and then we have to go to shamana. We will try to convince the patient. Many times the patient gets convinced and they'll go for the shodhana. But certain occasions, the patient may not be willing due to some other reasons, even financial constraints. So in that condition, then we'll go for the Shamana Chikitsa, then opt for the ideal Shamana drugs for that condition. That is the usual protocol what I follow.
Yeah, one particular thing that I have observed, especially in your practice, is that very systematic case sheet, patients' vitals and basic information, then presenting complaint. We study that as part of our of our curriculum in the BMS and all, but we often forget. But I have seen that back in the day you were having like piles of case sheets arranged neatly month after month, so that you can access anything any time. Even today, I mean, for a comprehensive Ayurveda practice, as much as knowledge of medicines, knowledge of investigation techniques, all those things are required. A systematic case sheet comes very handy, as I see in you, sir.
So that's what even today I am maintaining it. I got case sheets of all my patients from all the 23 years. Last 23 years, what and all the patients have come to me. All case sheets are there with me even today. So I have kept it as a documentation part of it, but not I have digitalized this yet. And that is a huge task. I have not done it, but it is in the form of hard copies. So it is there. We need to have that, because many times for the presentation of our subject, our achievements, or our outcomes of Ayurveda, many times the people ask for evidence. So for that evidence purposes, we need to keep all these documents with us.
Yeah, case sheets are too many details about how to narrow. I mean, let me tell you that Gururaja sir's case sheet, even for on an OPD basis also, he takes like detailed case sheets. I mean, more the details, better, so that we can remember. Your comments on this?
It is not a hard and fast that you should have a lengthy case sheet. You can curtail it to a shorter one. Important thing is that we have a Dashavida Pariksha Bhava. So based on those 10 factors, if you collect the information from the patient, that is sufficient. So that can be done. And that doesn't mean that in every patient we will have a history. For example, a patient has come as a male. So we no need to ask the menstrual history. It's very well evident. No need to go for it. Then patient is a very young one, doesn't have any family background, any history or anything like that. Then why you want to go for any family history? You can skip all those things. It doesn't mean that it should be always to go for the prescription. But in a Western countries, when a patient comes to you with all sort of approaching to the other doctors, and when their doors are closed to them, or they didn't find any relief, then they are approaching to you. And because of the legal constraints, it is better you go with a very detailed brochure and questionnaire. You provide in handy to the patients in advance. Let them fill it up in the lobby. Then once they come into consultation, then you can go for analyzing it. That's a good idea to do that. So that will be more beneficial even for any legal purposes, as well as your presentation of data anywhere in the peer-reviewed journal or even in the seminars.
And also regarding the lab reports, whichever are like in the out of range, maybe TSH or HbA1c. So better to write those, at least the out of range things in the case sheet itself, so that we can refer back.
Definitely. I usually write down everything, whatever the patient comes to with all the documentation, and sometimes even a Xerox copy, a photocopy of that is been tagged to their case sheet itself. So then for repeated when it comes for the things, once again we'll go for the repeat scans, a repeat check of these blood reports. Then we try to compare with the earlier one. That is a good area. Even patient is also gets convinced, and we also can convince our counterparts. They always claim that they are the only science and masters in the field, and we are all just secondary and all these things. For them also, it can be shown that, see, this is the thing what we can do or achieve through Ayurveda.
I can see that in a big city like Shimoga, you hold high respects from both the fraternities, from our own people and also the counterparts. I mean, of other medical sciences. The only way to hold our head high and take the charge is through showing results.
Definitely, we need to have always comparative studies, and it is if it is presented in a scientific manner, definitely that document itself speak for us.
And do you come across clients where say they want to? I mean, they have multiple complaints, but they want you to focus on only one thing. For example, I have diabetes, hypertension, and high cholesterol. But I'm taking already many different allopathic or homeopathy other medicines. I mean, I come only for infertility. So please concentrate on infertility. Do you get such cases, or how to handle?
Yes, then definitely I do get such cases, and that's a quite interesting thing. I'll try to explain them. This is the thing what you're suffering from, and you want me to attend only this case. Only I can attend it. But provided if you are convinced about the outcome and how long you are going to take my medicines, that is a plus point number one. Second thing, I will not going to touch any medicines, or I don't prescribe anything for your other diseases which you're already taking medicines. So I'll keep aside, and whichever the things they are taking, I'll note down it, and you will give a typically time gap between the medicines of Western drug as well as our drug. Then I try to select our drugs for the particular condition for which he has approached me. There is no harm and wrong in doing in that way also. If a patient needs any type of thing which he is not getting he is not getting a in other doctors, if they are approaching to Ayurveda for that particular means, it's okay, no problem, no issues with that. We can handle even that condition. It doesn't mean that we only have to handle all the conditions in the present in one patient. Doesn't make any sense. If a patient wants that, that is better. It is because we are in a 21st century and it is a consumer driven field. We cannot simply, certain times we may have to stick on to our area, our domains. We should not leave it. Just what I said in the last class, that if some person asks for a particular type of medicine to be prescribed, then why he has approached me? You can prescribe by yourself. If you want me to do things, then let me allow to do it. It is my area. You should not trespass it. So that's the thing we need to understand. If a patient comes to us with certain type of things that I am suffering from these conditions, but I want only your medicine for this condition, can you do it? When such question is the first, I'll select that. Okay, no issues. We can do that. Once he develops a confidence in our treatment, slowly he is able to observe the result. Then he only slowly shifts to our medicine. Then he'll ask, doctor, I am satisfied with the way you are handling me and my results are seen. So can you offer even the medicine for my diabetes and hypertension? Then he will come to us later. So that is our way of handling. And if you could able to give result in a right sense, definitely patients will take even for the other diseases what they're suffering from.
I mean, if the client is taking like a 78 allopathic medicines for cholesterol and different things, so when you pick Ayurveda medicines, do you kind of restrict the number of Ayurveda medicines that you're giving so that the patient doesn't forget and it's all mixed up?
No, I don't go for all those things. I concentrate on my area for which he has come to me, and whichever the drugs which are best suited to that condition, I'll prescribe. Maybe 2 drugs or 3 drugs or 5 drugs. Doesn't make any sense. I'll go with the whatever the drugs which is suitable for that condition, I'll prescribe.
Before I go into the chat questions, I mean, when the client is taking like both Ayurveda and allopathy medicines together, I have a theory. I just want to cross-check with you that better for them to take allopathy medicines first and then leave a gap of like 30 minutes and then Ayurvedic medicines.
I follow the same principle because almost all these allopathic drugs are synthetic one, and within 30 minutes usually they will be disintegrated and get absorbed. And once they go in, there will be some receptor based medicines and receptors they will carry, all these things will happen. So such things happen, then the drug interaction won't takes place. So that's the reason we keep at least 30 to 40 minutes gap, and preferably an allopathic drug should be taken first. If it is there in that prescribed by some doctor in that condition, then later Ayurveda drug, because Ayurveda drugs are, most of them are herbal, and these herbal drugs may take some more extra time to get digested. So if we take herbal drugs in the beginning, then we may have to give a time of 1 hour or so, or 1.5 hours or so. So that becomes a lengthy time. So in order to overcome that or cut short that, I prefer usually if any person already taking some allopathic medicines and it is in the before food or even after food, then at the particular time, if our medicine has to be given, then I suggest them to keep it a half-an-hour gap between these two medications.
And from the chat, have you felt the need to use allopathic drugs for acute relief anytime?
No, definitely many times it happens because we are having some lacuna in having a, emergency management type of conditions. We do find certain times some difficulty, of course, but I don't go for prescribing it. I just say ask them to go to a person who can prescribe it to take the things. I don't prescribe usually allopathic medicines.
And you might not be knowing because this is Dr. Rohini Guraj sir's wife, sir, opened a simple OPD clinic in the center of the city, and in a few months' time there were like 3 to 5 to 7 a lot many patients, even with the evening practice also. She told that I peculiarly remember that there will be some patients who would come with a vial and an injection that some other allopathic doctor has prescribed, and they want simple doctor to inject that. If such a client comes, so she will she will honestly refer them to allopathy center rather than she doing it or Gurus are doing it. Like very scientific in approach that what they do and what they are not doing. So such a kind of boundary helps us to concentrate and focus on the diseases that we are really capable.
Definitely. So we need to draw our boundary lines where we are supposed to play and where we are not supposed to play. Allopathic drugs, we don't want to, because even though we know it, how it works, it can be given. We also been given training, but that is a secondary. I don't want to use it in that sense. Legally, there is a certain issues also, so we should not do it. So when that everything gets cleared, then it is up to our rational thinking whether to use it or not. That is a secondary issue. But right now, since my 21, 23 years of practice, I have not ventured into prescribing or using those medicines. If any situation arises, I will straight away send the patient to the Western medicine practitioners or allopathic practitioners for the particular type of requirement and services and treatments.
Another question has come, like when the client is taking like allopathic medicines, there can be side effects. For example, this amlodipine has bleeding gums problem, hypertensive medicine with bleeding gums, or paracetamol with liver, or painkillers with liver injuries. So how does one know if their health complaints are in fact the side effects of these medicines, or benign, the patient has definitely samprapti getting the symptoms? So how do we differentiate?
It's very difficult because we need to go for a very fine observation. We need to go for, if a suspicion is there in the beginning, then try to remove those drugs from the prescription for a time being, observe the facts. If the things are solved, then definitely it is due to the drug. If it is not, even with the drug withdrawal also we are getting the same results, means then it's not due to drug. Then you introduce the drug back to towards original position and try to analyze for what reason particular lakshana is appearing, the bleeding is taking place. So accordingly treat the condition.
Was there any instance where like patient was like taking two or three allopathic medicines and you asked the client to stop all and started afresh with purely Ayurveda?
Usually I don't do all those things, because when a patient comes to us with a lot of issues, we don't want to just remove their supporting stance. They are standing on some support. If you remove everything using it, it is not a right kind of doing in a treatment, because whenever Rutucharya has been explained, while shifting from one Rutu to other Rutu, the Sandhicharya has to be there. Slowly leave the things behind and then adopt the new things. That technique has to be adopted even here. We don't want to just simply jump from one to other. If we jump from one to other, there may be problem. So we don't usually prescribe, or we don't suggest that leave everything in the behind and come back to us and we will eat it. No, it's not the way. Slowly we convert that into our field without causing any harm. That's the method of what we adopted.
That sounds kind of in line with this. One is following Viruddhahara, and he has to be brought into the Patya Ahara. So Master Bhagavata says like Padam Padam Chatam Chajet. So it should be like quarter by quarter.
Yes, definitely. It has to be left slowly, part by part, part by part. It has to be left, and the new things has to be imbibed.
One of the problems with especially with the blood sugar or hypertension, the client is already taking allopathic medicines. This is one of the mistakes that the new Ayurveda doctors without much experience that they do is they see this 120 by 80 and though the person is on modern anti-hypertensive drug, they think that because it's already 120 by 80, they can like withdraw the modern antihypertensive, which can be really dangerous because the 120 by 80 is achieved because of the medicines there.
See, first of all, we need to understand for what condition we are prescribing the medicine. First of all, the Ucha Raktachapa or hypertension is not a disease where we brand it as a cured. It is a Yapya Vyadhi. It has to be continuously, the medicine has to be taken. So in that sense, when by giving ideal or a normal range is achieved, when you remove the support, then it once again it goes out of the way. It should not be done. If any person is consuming a medicine for particularly a sugar or hypertension, then it is reached to an ideal level or a normal range, means with the support of the drug and of course with the support of the diet and so many other factors. So don't disturb it. Just once it is reached, withdraw the drug. No, don't do that. Try to maintain the drug. Then in the next sittings, if continuously the same thing is achieved, then try to reduce the dosage of the drug. When you reduce the dosage of drug, next time also, if the blood parameters or even the hypertension parameters remain within the normal limits, then it is ideal. Otherwise, increase to the level optimal which is required for that condition. So that depends on case to case. It's not a uniform pattern for everybody.
Yeah, I mean, one small topic there that somebody is on a modern anti-diabetic medicine and he is willing to switch to Ayurveda. How do you do it? Meaning gradually, or once in how many weeks you ask the client to come back and with a lab report for progression? What's the strategy there?
Usually 15 days gap I'll do it. Every 15 days I will go for the blood check as well as even this. Then accordingly we can finalize it. So we will go with a uniform pattern of whatever it is there in the LFT or even the lipid profile or something like that, or even the blood parameters and sugars. Accordingly, we will go step by step. Every 15 days, we will take a report and compare to the earlier one. And accordingly, whatever the outcome has come with the medication, based on that, we will take a call.
Weaning of modern diabetic medicine. On an average, how many weeks or months that you take that you do the complete shift?
It is not so that in every case we cannot go that. If it is a newly diagnosed case with a recent onset, then definitely we can go with this type of weaning and all those things, and we can even able to achieve it, totally shifting the patient to Ayurveda medicines only. But patient is already 6 years, 7 years, 10 years are already known diabetic and he is taking a lot of medications, then still his blood sugars are not within control range, then we are introduced our drug along with the modern drug, then it has achieved to certain level, means we cannot simply wean the modern drugs here. Slowly we need to achieve the balance between these two. And many of my clients, they use both type of things, particularly in case of diabetes and hypertension. I've seen many of the patients, I can broadly classify them into 3 categories, where young new cases, very easily it can be brought to the purely Ayurveda category, drugs with Ayurveda management. Then we have got a middle section where both the type of drugs are required, modern drugs as well as Ayurveda drugs are required to control the condition, to bring it to the normalcy. Then we have another one, even with all these medication, they won't come into control range or normal range. That is the beyond the, and go on changing the dosages and even the drugs. It gives a lot of trouble in handling them. So such type of patients are also there, but they are fewer. People with clear cut them to Ayurveda, this is somewhat, let's say about 30 to 40%, and remaining 30 to 40% is in the middle age one, because we need both both the type of medications for them, and only remaining 10 to 20%, it is beyond our control. Such type of combinations, what I get usually in my practice.
Last question for the day. It has come in the chat. Acharji, what would be the best medicine, Rasayana, Gruta, for Vata dominant person having sagging skin? So Vata dominant person with sagging skin, wrinkles, fine lines on the face, and formation of skin folds at the wrist joint, which remains persistent with significant weight loss. So this sagging skin and the skin folds is usually observed even with a heavy obese person losing a lot of weight. They'll be having these issues. What are the choice of medicines?
So, no, we need to go for, see, simply just because certain lakshanas we don't want to a prescription. Try to understand for what reason it is there. What is the reason for this, and what is his other lakshanas? What is his previous history? What is the history of present illness? How it is started? When it is started? Since how long it is these conditions are there? If a person is Vataja nature, which has developed all these things without any of major manifestations inside the body, and he has not taken any medicines for that, then the better choice for this to prevention of this sagging and dryness and even wrinkles and all those things is Estimadu. Estimadu will be the best drug for this condition. You can go for Estimadu in the form of what you call Dugdapana. Estimadu, Ksheerapaka we can create and give it regularly.
I mean, if it is just purely weight loss treatment or diet, with that weight loss is happening, and due to that sagging of abdominal skin, all those things are there. Probably oil massage with Vatahara oils like Balashogandha would like stiffen up the skin a little bit.
See, if sagging of skin has been taken place due to previous obesity or even with the pregnancy, after the delivery, and now you are suddenly dropped your weight in both these occasions, the skin has stretched and become loosened, that cannot be brought back to the original condition. It is not possible. That's point number one. We can give certain relief by doing some udvartana karmas, and by using kolakulattadi churna, or some using even some Estimadu taila. These are things, if we use it, to some extent we can give relief, but it cannot be brought back to the previous levels, how it was before the pregnancy or how it was became best. Such levels the skin cannot be brought back because it has stretched beyond a certain limit and suddenly it has dropped. So that sagging will be there, that cannot be brought back to the normalcy.
Thank you very much for active participation with interesting questions. We will be continuing this. This is not just the last one. We will be continuing for many days. Thank you very much for all, and thank you very much to Guraja sir for guiding us.
Thank you, Janardhan. Thank you, and all the panelists.